Hello, everyone. Thank you so much for joining us today. I am so excited to have Dr. Tom Grant with us today. The subject of PI has been coming up more and more depending on where you are around the country. It's a hot topic for 2018. And we were getting so many requests about more information on the PI side of practice. And with that, that we always reach out and try to find the best consultants that have the best information. And I can honestly say that we feel that Tom Grant fits the bill in this respect. We usually don't have anyone on this webinar series that we have not sat in their class or, worked with in some capacity. And Dr. Grant has been incredibly helpful in working with Dr. Foxworth in his practice. And it is through that experience of working with Dr. Grant that Dr. Foxworth reached out to me and said, you absolutely must put him on the webinar series. And so I'm so excited to have him here today. He is a personal injury practice coach, a speaker, an author, inventor, educator, and entrepreneur. His mission is really to help PI professionals gain greater confidence, skill, and strength to successfully deliver pertinent and timely care for the best personal injury recovery. He has been on radio programs, invited to speak about personal injury protocols at attorney and chiropractic state conventions, national webinars, and in private practices. And his results truly speak for themselves. Again, I can tell you that his assistance with Dr. Foxworth and his team has been just absolutely incredible, and that is why we are so excited to have Dr. Grant here with us today. Dr. Grant, thank you for being on the webinar series.
Christy, thank you very much for having me here. I'm really grateful to ChiroHealthUSA for putting me on today. I really appreciate it. Personal injury is a passion for me. It's been a big part of my life even before I became a chiropractor. I went to chiropractic school when I was 40, and prior to that, I'd been in 7 previous car crashes. And I had received different levels of care, from caring for myself to being cared by medical doctors, cared by chiropractors, represented by attorneys, not represented by attorneys. I've been through a lot of different things, slip and fall injuries. It's an amazing process. When you've had personal injury, you have a very unique and different perspective about the care that we're commissioned to give as chiropractors and other healthcare professionals. So once you've been there, you understand a little bit more. So I wanted to share with you today a topic that is very dear to me within personal injury care, that is misunderstood by a great many doctors and also by attorneys. And that's that personal injury care is not health care, and it never should be. And we're going to discuss that today. Now, you may find that to be quite controversial, and I don't mind being a little bit controversial. I think here's the thing. If you don't think outside the box, then you're going to have some issues with staying in the box, that the box continues to get smaller for us in the healthcare profession. Fewer and fewer services are reimbursed. Fewer and fewer types of payments are being provided to us. And we're going to talk about that today and why this all kind of plays into the subject I want to talk to you about. I'm going to do a little quick testimonials on some of the folks that have had some success with my practice while I talk to you a little bit more. So when we talk about healthcare, I'm going to define that. Then we're going to talk about personal injury care. We're going to define that too. Then we're going to talk about our place within the healthcare arena and the personal injury care arena, how that compares. Then we're going to talk a little bit about what we need to do to change where we're at in that healthcare paradigm. So let's get started. So first thing I want to do is let you know that insurance, if you haven't done much thinking about it, some of this you may go, duh, that's common sense. But I meet a lot of doctors who actually haven't thought much about this. But insurance is about risk management, and I teach risk management classes to medical financing companies. The ones that will pay for care when somebody's had been in a crash and they haven't got any more benefits left, but they need services. So I had taught risk management classes to them, and here's the upshot of it. It's about risk management. It's designed to pay out less money than what you take in. That's how you make a profit. So whether it's healthcare insurance or it's personal injury care insurance, it's still an issue regarding profits. And the entity that controls the money makes the rules. And if you don't observe the rules, you don't get paid. So we're going to talk about some of those rules today and what we can do to help ourselves get paid a little bit more. So let's talk first of all with this illustration. This is a graphic representing the available policy limits on a given personal injury claim. That's what's there. If it's $25,000 policy limits in your state, that's fine. Some states are 15, some are 10, some are 35, some are more. Now that's the minimum. You can go up from there. There's $100,000 policies, $250,000, $300,000 policies. There's $1 million policies, which is what you generally find with commercial cases. Then we go down to this part right here. So you've got what's available in policy and then what was billed. Then we get to the part of what was paid. Now I want you to realize that this is what the policy is. This is how much was billed on the medical care, and that's how much is going to be available then for settlement, and then what was paid. We've got this little red dot in the middle. So we're going to talk about that as we go along through our presentation today. What does this really mean, and what's the difference in the circles? So first of all, let's talk about what health insurance is. Number one, it doesn't compensate for injuries. Healthcare doesn't. If somebody comes in, they have low back pain, the health insurance company doesn't say, well, I think that's worth about $500 to $1,000. Let me send you a check. They don't do that. It limits coverage by contract. We know that. Whatever the benefits are within that policy that's written for the patient, that's all we can give them care for if they're applying for health insurance. It's limited reimbursements. You're generally under contract on what they'll pay us for particular services. But there is one really big important thing is that it's annually renewable. So even if somebody has a pre-existing condition, they can go through a waiting period and still qualify to get that insurance again. And sometimes if they pay extra high amount, getting some different kinds of policies, they can get covered even with pre-existing. So, but it's a renewable benefit. So in healthcare, though, this is the part you probably aren't going to be too happy with. But in healthcare, chiropractors are contracted to be therapists. They give us limited coding. They give us limited diagnosis-based treatments that we can provide, and they accordingly offer us lower contracted reimbursements. And on an average, based on the Department of Labor Bureau of Labor Statistics, chiropractors are paid less than physical therapists on average. We're at the bottom of that healthcare paradigm. And I don't like it. I would like to see that change, but this is not a topic about healthcare today. This is a topic about PI. But we got to start with where you're at so you can understand where we're going. So the next thing we need to talk about is what is the process of the healthcare. So healthcare uses a risk-based system, and remember, they determine the rules. And so their rules are this: a low-cost service to help the policyholder back to a manageable state of health. Now, a manageable state of health for them is decreased symptoms because just about everything in healthcare is driven by symptoms. And so we've got these symptoms, and they don't necessarily cure it. They're not into the curing business necessarily. It's trying to get rid of symptoms. So if you got a broken bone, they're going to set the bone so it'll heal. And if you need some kind of surgery to get something cut out, they're going to do that. Now, they think that they're helping you get back to health because they manage your symptoms, but we know differently. Health is not just symptom management. It's about getting the body back to full functioning if we can. But they still control the benefit type, who's going to give that particular care the patient is needing, how long that care is going to last, and then how much those reimbursements are going to be for the services you provided. And again, it's an annually renewable policy. And you can repeat it year after year after year to help the patients manage their ongoing symptoms. This is a really important part I want us to look at. Healthcare uses ICD-10s. Now, ICD is the International Classification of Disease. There's over 100 countries that use this international classification. In the United States, AMA owns that. They've adopted it, modified it, and they own it for the purpose of identifying, describing, and coding the medical, surgical, diagnostic, and treatment services. That's what they do with the ICD-10. And so and he actually had the designation CM, which is the clinical modification. That's what we use in this country. So there's a whole paragraph there. We're going to pick it apart because it actually affects what we do with PI. But you notice I got a highlighted yellow part there. Let's see what that means. So now I'm not sure if you see that They combine them. It's a combination of diagnosis and symptom codes to reduce the number of codes needed. Interesting. They reduce the number of codes needed to fully describe a condition. And that's really important, to reduce the number of codes. So what do we know about healthcare? Well, the emphasis is placed on an efficiency. Okay, it's the insurer's ability and desire. They don't really want a ton of paperwork, which is why unless we're being audited or we decide that we're going to send notes in on an appeal, they generally don't get our daily treatment notes. They just go off of our coding. So the emphasis is the efficiency part. It generally is set up around a single disease focus. Somebody comes in, they have a low back pain. They generally don't come in with 3 or 4 or 5 different things all at the same time. They come in with one to you because you're the musculoskeletal guy. They're going to go to a nephrologist if they got a kidney problem. They're going to go to an oncologist if they have a cancer problem. They may be suffering from all of those, but they don't go to one provider for all of them. They just pick one, and that's what you're taking care of. It's a strict limited duration type of care. They seek for paperwork reduction. They do limited coding, and they do bundled coding. It's a contracted payment thing, and once again, it's that annual policy benefits renewal. So here's where we're at in a healthcare paradigm for healthcare insurers. Now, if you run a cash practice, which is a very high possibility that you will being on today's program, while you may not necessarily think this is important to you on a cash basis, this is still where you're at in the hierarchy. You've chosen to do cash as your form of payment, but within the medical system, this is where you sit. Hospitals reign supreme. Beneath them are specialists. Underneath them are general medical doctors and nurses. And underneath that is therapists. And here's our therapy lumped process here. We're all in the rehab business as far as the healthcare world is concerned. The physical therapists and occupational therapists, they rank higher than DCs and acupuncturists. And then you got your respiratory therapists, naturopaths, nutritionists, massage therapists, etc. They're all in the rehab box. And that's how we rank in healthcare as a general rule. It doesn't have to be that way. We're going to talk about that. So here's our next one. So liability insurance. We need to know a little bit about that. It's an insurance that's purchased to protect against liability for losses and damages that happened because someone was negligent. The policyholder was negligent. The limits of liability for that policyholder depends on what he bought. If you've got a rental car, you've probably got a $300,000, $500,000 policy set up there. $300,000 per incident, $500,000 per total. So that's kind of the stuff you're looking at. But it's to help minimize risk to the policyholder. And one thing that isn't on the slide there is that this is what insurers are supposed to do in liability insurance. It's to they have a fiduciary responsibility to limit the exposure of their policyholder to lawsuits. Now they say, "Oh, that's fine, but we're only going to take it up to a certain amount, and then after that, all bets are off. If somebody wants to go after their personal assets, they can." So that depends on how much policy you buy, on what your risk is. So the personal injury care then is a risk-based system, just like health insurance. And once again, the insurers determine the rules. Now, their rules are very clear. It's settlement for the lowest cost possible because they're not into health recovery. They're just trying to find out, how do I get out from underneath this legal obligation I have to cover somebody else's injuries because my policyholder was negligent. Now, in order to do that, each injury is monetized. In other words, each particular injury has a certain medical value. And they consider pain. That's their big thing. Is if they're not in pain anymore, they must be all better, right? That's their process, and we have to help them understand that's not true. But anyway, each injury is monetized. They consider pain. They consider what the lifestyle impact is, your ADLs, that kind of stuff. They talk about what is the possible future medical care. And all of these things are designed to create a settlement for the least amount possible. That's what they want to do. Now, if some of you have some pretty interesting experience with dealing with insurance companies and settlements, and some of you have attorney friends that kind of give you the inside scoop, but it's pretty amazing what insurers will stoop to in order to try to avoid the responsibility for paying for a claim. And I'm going to help you understand how that works with Colossus. But remember that personal injury care is not a curative solution. They're not looking for a cure, and there's no maintenance benefits in this. And this type of a claim is final. When that settlement closes, it's done. You can't renew it year after year for this same particular problem. So let's go to the next slide here. So once again, personal injury care, it's the effort made to restore physical, mental, and emotional health losses through licensed trained professionals with an understanding. Those professionals have an understanding that the specificity of their medical documentation process influences the final settlement for the victim's current and future loss compensation. They're using your records to determine what they're willing to pay that person for their injuries. And I'll tell you right now, I won't get into some of the detail I want to today because of time constraints, but I can tell you that minimal documentation equals minimal settlement value. That's the way it works. It's a very easy relationship. I wouldn't say it's one-to-one, but I will tell you that they get a lot lower settlement if you don't have very much in the way of documentation. So let's look at this again. So personal injury care is not health care. Here's this code again. And it's highlighted here on the screen that the creation, this is what ICD-10 does, is the creation of combination diagnosis symptom codes to reduce the number of codes needed to fully describe a condition. Now, I'm going to take a moment here to talk a little bit about what it is I do. I have a couple of companies. One of them is Pragma Intel, which is the online training for Colossus and other personal injury-related issues where we don't get enough training. And so it helps us bridge the gap on what we've been told and what is actually happening in the insurance medical management software. So I have another company that I do medical validations, medical records assessments, and consulting with attorneys. And that's what I've been doing for years. And they send me their records, and I look at it, and I say, okay, well, this is what you've got in the chiropractor's records, in the surgeon's records, in the pain management records, in the physical therapy records. And we look at all of it, and we say, okay, we will take all of this information and try to make the best possible synopsis of what's happened across all care providers, because number one, care providers don't talk to each other. I don't know why that is, but they don't. So we're not sharing records the way that we need to. And I look at the records and say, wow, they treated this person for this particular condition over here, and then on this side over here, they're treating them for a different one. And one of them saying there was a car crash without airbags deployed. The other one says the airbags did deploy. The police report doesn't say anything. I mean, it's taking all of this miscommunication or disconnect and trying to make some sense out of it. And the one thing we've learned through the whole process is that there's at least 2 to 3 times more codes available in the documentation than one the doctors are actually identifying. And then there's all the hidden injuries that aren't being identified because they don't realize what the symptoms as a whole are actually meaning. And that's it's a pretty disappointing thing when somebody doesn't catch a concussion, or when somebody doesn't catch that the patient has some organ damage because they've misunderstood what different pain values are. There's 5 different types of pain, and they're not getting that right. You know, you got your viscerotomal, you got your dermatomal, you got thermotomal, you've got a bunch of other ones here that, when they're all put together, will help to tell you a picture of where the real injury is, not just where the pain is at. And that's where we can differentiate ourselves as a profession, is becoming more expert at understanding personal injury. There is no one profession that's designated as PI experts, yet we can carve that out for ourselves if we'll take the training and get trained in that and get the specificity that we need in the record. So anyway, I want to take a moment to tell you where I'm coming from with this, because I get that all the time. I just picked up 4 cases just the other day it's amazing. You got a dog bite, 2 dog bites, a gunshot wound. And you think, wait a minute, a chiropractor taking care of dog bites and shotguns? Yeah, absolutely. We can do that. And it's what you do with it that makes a difference. And it's pretty amazing what we can do as a profession when our training is elevated. So here's this. Now, unfortunately, I don't know if you can see the coloring that I had put on the slide, but I'm not seeing it on mine. But the bold part is important. Reduce the number of codes needed to fully describe a condition. Remember, they're going to monetize each injury. And if we bundle it together, we're bundling the whole injury into a lower value. That's the way that works. So if I have a shoulder injury and I use a simple sprain and a strain code and then a pain code on top of that, or a spasm code, I'm taking three different codes when there should have been close to 15 for that same injury. That has to do with edema, has to do with effusion, has to do with a vascular compromise. It's pain, it's neurological, it's muscular. There's a bunch of different articulations in the shoulder, not just 2. And so it's more than just the glenohumeral joint. There's other ones that are involved, and all of those are affected. The shoulder is held together by muscles. And the only reason it functions is because the muscles are coordinated correctly. And you can have a sprained strain in multiple different muscles, not just the quote-unquote slap lesion ones or the rotator cuff. There's other ones too. When you start taking the whole entire parameter of an injury together, it's very easy to get 15 or more injury codes just for a shoulder. Each one of them has a monetary value. So am I going to use 3 because of these bundled codes, these combination diagnosis symptom codes that the healthcare system put together so that they could reduce their paperwork? The liability insurers love that. They love that reduction because now they can devalue the injuries that we have because now they're all bundled in a big master code. But we separate them out and make them exactly what they are, then we get more value for the medical condition the patient is suffering from. So this next slide, the part that I want to highlight for you is called the expanded injury code. Now that's the information just prior to this combination diagnosis symptom codes reduction that they did. So they talk out of both sides of their mouth in this particular code description. It says they expanded the injury codes, but then it's going to reduce the number of codes to describe a condition. And then I'm going to do the next slide, and I don't know if you see the colors, but once again, there's the follow-on that says, and they want to give you greater specificity in code assignment. So here they say more injury codes, more specificity in code assignment, but sandwiched between those two is we want to reduce the number of codes. That's talking out of both sides of your mouth. But that's the old cover their backside thing, because in personal injury care, it's the first one and the last one, not the middle one. It's the outside of the sandwich, not the middle, that has the greatest value in personal injury care work. Expand the injury codes and greater specificity. When you reduce it, you do it with healthcare. Healthcare teaches you to do the middle part. If you use healthcare to do your initial intake and your treatment plan, then you're actually going to reduce the medical value for that patient, which ends up in a smaller settlement value to them in the end, which means you're going to get discounted. We're going to talk about that. So here's where that is. We got this policy limits, that's this big round circle there in the blue, and then we've got that purple one in the middle, which is what you billed, and then you've got the red one is what was paid. Now it's what you were paid, what the patient was paid, and what the attorney was paid is all in this little small circle. So well, what happened between the purple and the red, and what happened between the blue and the purple? Let's talk about that. So between the blue and the purple is the things that you didn't do that affected the claim. It's because you didn't do enough of the injury discovery. I can tell you right now that if 93% of all car crash injuries have a concussion. It's in your notes. I see it every day. And you don't get that documented. And when you don't document a concussion, then you almost always fall immediately into the minor impact soft tissue injury classification, which is a low settlement value. They're not going to pay very much. That's where Colossus is most effective. But if you have a concussion, Colossus doesn't know what to do with brain injury, so it's calculated differently. So if you don't find them, and 93% of the time they're there, then you've already reduced from your blue circle down to your purple. That's the problem. And it's more than just that. There's other connective tissue injury issues. There's impairment issues. There's future medical issues. All this stuff falls into this, what you didn't do that affects the claim circle. So let's go to the next one. The next one is between the purple and the red, which is what you build and what part has been paid. That's from missed coding and incorrect coding and unsupported documentation, because that's what the software is designed to do. It looks at it, uses artificial intelligence. Those software programs can read a 300-page record in 55 seconds. What are they looking for? They're looking for whether or not your injury had the right symptoms attached to it. If you say, oh, they got a ligament instability, well, if you don't have the symptoms of a ligament instability, it's going to throw it out. I don't care if you use the code. It doesn't matter. It has no value when it comes to settlement. Maybe you got paid using that code. Well, that's fine. You can get paid and it still doesn't have any value on the settlement. Because what attorneys don't tell you, and I don't know why this is, I talked to some recently, and they said, hey, I said, why don't you talk to doctors more about the outcome of the settlement? He says, well, I don't know. They don't participate in it. I said, yeah, they do. Because if they know what didn't work in the settlement, they'll know what to look for on the other end of it when their next case comes up. I said, not talking to them doesn't help you or them. But they still as a profession, don't involve us in the settlement process, except for to say, hey, would you like to take a discount because I can't settle this case for enough. When I hear that, I can immediately tell you that the documentation wasn't correct and the attorney didn't know how to move ahead with that. And that's the other business that I have, is I help them with it. So anyway, you got the wrong coding, or you've missed codes altogether. Typically, I'll see between 8 and 10 codes on a personal injury claim when there should be 40. And you think, what, 40 codes? Remember, I'm going to go, let's pop back up here. Remember right here, reduce the number of codes needed to fully describe a condition? That's what you're doing. But when you expand the injury codes and get better specificity, you're going to have 40 codes on the case. So let's talk about this going a little bit more forward here. So what are we going to do about this? Well, first of all, as a trained professional, this is what you have to know to provide. You have to make sure you have the evaluation and management of all the injuries. You'll notice that's in caps, all the injuries. Now, I recently got together with a Department of Professional Licensing in a given state, and I said, hey, can chiropractors use fracture codes? They go, oh, no, they can't. I said, what do you mean they can't? They say, well, they can't diagnose a fracture. I said, I understand that. They can find it, and they can send it out to an orthopedist to go ahead and treat. But when that patient comes back to that chiropractor for therapy for that fracture, can they use it then? They go, oh, wow, well, it seems like they should, but I guess we'd have to address that. We have to look at it a little bit more. It's like you don't have to look at anything. That's in healthcare. In personal injury care, if you're rehabbing a patient for a fracture, you need to identify the fracture in the records that you're providing therapy because of the fracture. Otherwise, they're saying, what are you doing that therapy for? Well, they've got problems with their muscles, and they have to build their strength up and get their neuromuscular going and all this. And they go, yeah, and? If you don't use the code that designated the injury that brings your therapy into play, then you're shooting yourself in the foot, and you might as well just be going ahead burning money every time that patient comes in the door because you're wasting it. So you want to get the E&M, okay? Make sure you get all the injuries. And then you want to go through here, and you want to make sure that that the injury needs to be monetized. Remember that. We have allowances for pain, loss of use, lifestyle impact, possible future medical care required. All of this is designed to lead to a settlement. And if you don't do it right, then it'll be for the least amount possible. So remember, from now on, starting today, you need to look at expanding the injury codes and get greater specificity in code assignment. Now, if you don't know how to do that correctly, you're still going to get trashed. So that's why I offer the training program, so you know how to get this into play. That's what it's for. So let's go on now. We've got PI medical necessity of care. This is not healthcare necessity of care. This is personal injury. And so you have to make sure that you've got the right mechanism of injury documented. And a rear end crash is not a mechanism of injury. That's a mechanism of damage. That's how the car got hurt. How about the person inside? And you say, well, they all got hurt. No, they didn't. I've got car crashes that I've worked on where one person died, the other person walked away without a scratch. The person that died got $1 million because it's a commercial policy. Shouldn't the guy without a scratch get $1 million because he was in the same crash? No, he didn't have the same injuries. If you don't document how that person gets injured, they're not going to get compensated for them. So your medical necessity care is a little different. You need to correctly document your injury causation. Remember, rear end is not a car crash injury causation. It's simply a mechanism of damage to the vehicle. So you have to know, how did they get that bruise? How did they get that cut? How did they get that sprain? Then we want to diagnostically validate the injury severity. Injury severity is not a part of the ICD-10 codes. It's not there. But there is a way absolutely to validate the injury, and that's the symptoms. You have to make sure that you're documenting correctly. I've got doctors who will say, oh, yeah, they've got radiating pain when it wasn't radiating at all. It was referred pain. Referred pain is a facet or a peripheral nerve entrapment, where radiating pain is going to be almost always a disc or some kind of a central nervous system issue. Okay? And that's usually going to be caused by a disc getting put pressure on, or bone putting pressure on the spinal cord. I mean, it depends on the nature of the injury. But nevertheless, can you have a facet injury along with a disc injury? Absolutely. Can you have a disc injury without a facet injury? No. Can you have a facet injury without a disc injury? Yes. You got to know what the different designations are for knowing what is a particular type of injury pointing to. Then we need to get to the provide the substantiated treatment plans. If you put a treatment plan together, and most of them I see it are more a plan of care versus a treatment plan. Plan of care is what you tell the patient you're going to do to help them get better. That doesn't impress an insurance company at all. You need a treatment plan where you identify specifically the things you're going to accomplish, what your measuring tools are, how you're going to get from point A to point B, and then at the end you say, see there, I got to point B because I did what I needed from point A. This is my trail, and I just proved I did it. So you got to make sure you get substantiated treatment plans. And all those are all dependent on getting a validation. So we go back up here to the validation. if you don't have the right diagnostic validation for your orthopedic and subjective findings, you don't have your objective findings substantiated with the right diagnostic test, they're not going to have much value at the end of the case either. I see that all the time. It's like almost that chiropractors never even took care of the patient. They just walked in and grabbed $3,000 or $5,000 worth of billing and then walked out again. And that's not what we do. We are very good at what we do on treatment, but if we don't put the documentation together, that's how it looks. Pretty sad. So we have to make sure we personal injury code the findings. I talked a little bit about that. You know, it took a good friend of mine who's a premier coder in the United States. It took me almost 3 years to get him to finally understand that personal injury coding is not healthcare coding. And whenever I showed him the coding I do, he says, well, that's not healthcare. I said, it's not supposed to be. The car insurance companies want us to use healthcare coding, but the truth is, remember we talked about it, I'm going to blaze right back on up here again, okay, right here. Their purpose of the ICD-10 is to reduce the number of codes needed to fully describe a condition. Yet in the same breath, they say expand the injury codes and get greater specificity. But healthcare is sandwiched in the middle, and that's where almost all of us are practicing. We've got to stop doing that. But we got to get training to know how to use it correctly. Let me move through here. All right, so, sorry. So you're going to do your personal injury code findings. You got to make sure you get those done. And then you got to refer out to your pertinent injury care providers. I can tell you, I guarantee you, that if you're the only treating provider in a case, it's 25 to 30 cents on the dollar for settlement value. That's what it is. I know a lot of attorneys that they only take cases that are where there's only a PI involved just because they're trying to be a community service. They make no money. They almost always lose money. Almost always. They only take it because they're just trying to be nice to the patient and to the doctor, but the truth is they don't want your cases because your cases don't pay anything and they can't afford to put much time into it. And so it ends up that the churn and burn types of attorney groups get those cases. Even if you got an attorney that's not, he gets that and he goes, oh man, I can't make any money on that. So he says, oh, I'm gonna sub it out to another attorney to finish off for me. And that's not the reputation we should have. When they see our cases, they just go, man, I'm looking forward to this because we give them real tools. Okay, so we got to refer out, make sure you're not treating solo, and then properly bill for services. There's a lot of people that don't bill right. In fact, the other day I was going into a meeting in a state, and it was having to do with some legislation. They were trying to fight for a clarification on what chiropractors can do. And one of the chiropractors had come to the meeting. I said, hey, I hadn't met you before, and introduced myself. I said, what do you do? And he tells me what it is he does for his practice, and he says, I've got this radio program. I said, you do? Okay. And he says, yeah, I don't really do much in the way of PI. I just do nutrition and stuff like that. I said, okay. So you don't treat your PI patients? You send them out? Oh, no, I treat them. I just make it submit. I just push it down. I depress it. I don't do much with it, just to minimize whatever it is I do for them. And I just was so stunned that I couldn't even say anything. And I had to go into this meeting. I had to stay focused, but I thought, that's ridiculous that you minimize the kind of care you give to a PI patient because, you do something else as a chiropractic specialty. They should be for referring them out to us. You're on this show today because that's the kind of work you do, is you do PI. If you happen to be here just visiting because you're not sure what you want to do PI work. Don't play at it. Do it. And if you can't do it, refer to somebody who's on the show today. Because we need to have doctors who are focused on what needs to happen to help these patients. So, by way of correct documentation, these trained providers, meaning you guys, us guys, according to our statutes, the statute-defined scope of practice, we all aid in the victim's recovery from all their losses due to negligence of another party. That's what we do. You think, well, I'm just doing the health care. No, you're not. Because the kind of care you do determines whether or not they're going to get a decent settlement, which means a recovery from all their losses, not just their medical bills. So we have a responsibility to do a better job of that, and I know that you will. It's the doctors that aren't on our call today or don't come back and listen to this later are the ones that I'm most concerned with because they're not going to do what's right and the patient is going to be harmed. So here's where we are. And remember the previous one, hospitals were in the outer circle. On this one, the experts for PI, notice on the upper left-hand corner here, it says liability insurers. The other one said health insurance. Liability insurers, the experts are on the outer part of the circle. We control what happens. Hospitals don't control it. They're just a service provider to personal injury insurance companies. They're just a service provider. In healthcare, they're the gods of healthcare. They control what happens. But in this situation here, in PI, the experts do. Now, if you're a trained chiropractor, you're in the outer circle. You control what happens. And then it goes to hospitals of the next part. Then you got your general MDs and your therapist pool. And you notice I have it highlighted right there that the untrained DCs are at the bottom of the pool. They are. When it comes to personal injury care work, if you're a rehab doc and you're not a trained doc, you're at the bottom of the pool. You don't get paid as much. And that's really tragic because you've got great skill. Our therapy is so important to patients recovering from their car crash injuries. But if you haven't made it the case for why they need your care in a way that the medical management software for the car insurance companies will actually accept it and use it, then you're at the bottom of the pool. And I'm sorry. That's just where you are. So get up out of it. Let's go to the higher level that we can be with training. So we need to make sure that we do that. So let's talk about comparison of services between healthcare and PI again. Now remember, in healthcare, victims don't get compensated for injuries, but they do for PI. Chiropractors can be used as an expert in healthcare, in personal injury care, but not healthcare. Healthcare doesn't consider you an expert. You're a musculoskeletal therapist. That's what you are. We need to get out of that rut. So the documentation detail required for settlement, well, first of all, healthcare doesn't settle, so it doesn't need that detail, but you do for PI care. Compensation to review medical records. When's the last time a health insurance company compensated you to look at some other doctor's record? They don't really. They don't care that you do. It's a code, but they don't care that you do it. But in PI, you get reimbursed for it. Pretty good, too. Somewhere in the tune between $500 to $650 per case in reviewing medical records. But if you're not requesting them and you don't know how to code it and you don't know how to put it together, you're not going to get paid. But you can be. That's just money you're leaving on the table. Compensation for general communications. And besides just the money leaving on the table, there's a whole bunch of stuff that's not happening. That's the records management side of the work that you can get compensated for. You should do it. Compensation for general communications. Most of you don't know you can bill a patient service if they call you on the phone, or if they email you, or they text you. Or how about when the attorney wants to sit down and talk to you about that particular case? That's a billable service. You're an expert. When you're trained, you're an expert. You get paid for your time. They do. I was reading an article the other day that said that the average cost for if you're an attorney that deals with corporate law and mergers and acquisitions, it's $675 an hour. The least amount paid is $200 an hour if all you're doing is medical record work as an attorney. So there's a big, broad range in there. So interdisciplinary cooperation reimbursed. When you're working with another doctor in healthcare, do you get paid to do that? Well, you do in personal injury care. How about the use of impairment reports? Healthcare doesn't even care what that is. But you do get paid for impairment reports in PI care as a DC. You do. Specialty exams provided by the chiropractor is accessible in PI. I'm questioning whether or not it is in healthcare. I'm not sure if they're actually reimbursing for muscle strength studies in all places. And I mean, in some places they are, but generally speaking, if you're doing a specialty exam, they're not going to pay you much for it, if anything at all. You'll have to bill it as a 99213-25 modifier, and then you're going to probably get denied, and you're going to have to find some kind of an appeal process. But in PI, you're paid for it. There's a limited DC role as a therapist. Yeah, in healthcare, you are limited. You're just a therapist. But in personal injury care, you can be much more than that. There are cap visits. Yep, in healthcare there is, but not in PI. Now you say, wait a minute, I can't. I just treat a patient for 40 visits, and they say they're only going to pay for 15 or 20 of those. Well, that's because you didn't do your paperwork right. I can tell you that. You do your paperwork right. You do the things that I teach you in my courses, and you will get that money. You may have to wait till settlement to get it, but you will get it. Then there you got your annual policy renewal. Yep, in healthcare, nope, in PI. When the settlement's done, the policy's over. Network listing, yeah, I guess if a patient searches for you long enough, they'll finally find you. But you still have to market like crazy to get people to find you in their network. But yeah, they'll do that. But in PI care, there's no listing. You're going to have to do the marketing anyway. So, that's just the nature of that work. Contract reimbursement limits, yes, in healthcare, not in PI. But you'll be limited in what you're reimbursed if you don't have the right paperwork together. And then do they provide training? Healthcare, no, they don't. PI doesn't either. When you say, well, my healthcare told me how to do it. Oh, yeah, they told you how to abide by their coding rules, but they didn't tell you how to make more money, did they? They don't, because they don't want you to make more. They want you to work within the confines of your contract, and when you start stepping outside of it, they'd like to spank you in the hands. So that's some comparison of services. Personal injury care is a great business to be in. But make sure you get the training. Because I see doctors who are in the business that aren't trained and they're not getting paid very well. In some cases, I see them get paid pretty good, but then the settlements are always crummy for the patient because they didn't do their paperwork right. So enough harping on that. Let's move on. So liability insurers, remember, we're on the outside of that ring if you're trained. That's where we reside. That's our life. If you don't get training, then you're in the rehab circle, which is at the bottom of the food chain. So where do you want to be? That's the next question, and it's your choice. You could be at the top with training, or you can skip it and be down at the bottom. Now, when I talk about training, I'm not talking about just going to a weekend seminar somewhere, although they're helpful. It can be a nice brush up on a point or two. But I can tell you, if you only pick up 1 or 2 points, but there were 10 of them required to do the job right, how much did you really benefit? So you need to make sure that you get expert training that's focused on helping you get where you need to be. And obviously, that's what I do, or I wouldn't be talking about it. But I want you to understand that this is a great thing for you to do to get this training. So here's what the training entails. Now, the most important part of what it is I have to tell you is coming up after this. So don't get too, I know some people start dropping off and they say, oh yeah, you're getting into a sales pitch, I'm out of here. The most important part of any webinar is the Q&A. You need to be formulating your questions. So while I'm talking right now and just kind of giving you a general feel for what it is I do, and I'm going to take a few seconds to do that, then you need to, shoot some questions to me so I can answer them for you because I haven't seen any pop up yet. So once again, the training is there. 13 key documentation tools to maximize your reimbursements, to hone your skills in finding, documenting, coding, and communicating injuries and injury severity to insurers. You need to discover the major tactics that insurers are using to discount and deny your care and how you can combat that, because I show you how to do that. Advanced training provides additional financial benefit to your practice and greatly helps your patients. It's amazing what it does for their settlements. Most, 2/3 of the settlement value is tied up in the things that you have to do in your practice. If any attorney's ever said that, hey, I don't really need chiropractors, they are dead wrong. Because there are 3 things they don't get if they don't have a chiropractor who's trained. They don't get the ongoing care, ongoing treatment designation. They don't get the future medicals, and they don't get the impairment rating when they deal with the medical world. They don't even know what that is. If you don't have that, then 2/3 of your settlement isn't even available to that attorney to negotiate for. He's negotiating for 1/3, and they'll discount that. They always do. So if you get the training, you'll take them to the next level. It's a 9-module video training course. It's pretty cool. I designed it so it would cover every type of learning scenario. So it's video training. It's transcripts, so you can actually physically hold it in your hand or scroll through it on your computer with a PDF. I have handouts that show you exactly what this looks like. I give you templates you can use in your office, and then I quiz you. You need to do the quizzes to see just what do you know. And then there's a final certification exam that is the icing on the cake that tells you what it is you can actually do with your degree, which is really cool. So there's the testimonials. I want you to read through those while you're formulating your questions, because I haven't even told you what the cost yet for the system is, because I got a special page that you go to as a be a part of the seminar today, this webinar. So here's 4 testimonials. Look at those. I'm going to put them up there for just a little bit. I'm starting to get some questions filed through, which is like totally awesome. I'm loving it, because that's where I want to spend my time. Okay. So I get some great accolades from medical doctors, attorneys, and chiropractors from around the United States. Let's go to the offer. Okay. So you're getting 30% off. That's what you get when you get into the system. 30% off of the Colossus Level 1 training. And you're going to get the access to that training for a whole year. You take it, get it done as quickly as possible, and review it as you go through the year. And I've told you that it's video, it's presentation notes, handouts, template forms, quizzes, and a certification exam. And if you order today with the link I'm going to give you, then you also get the amending medical records bonus. Okay, and that's a $120 value. That's how do you fix the records. You realize in the training, you go, oh my gosh, freaking heck, I messed up that record. How do I fix it? You can fix them legally, ethically, and morally. You can fix them. But you got to know what to do, and that's in the amending medical records. That's a bonus when you do that. You get Q&A support. You get discounts on additional services. I can tell you right now that all of my students get 50% off on my new courses. That's what until I have some reason not to, that they're always going to get 50% off. Like I've got one, documentation and coding of communications. How do you get paid to read records? to have attorney communications and patient communications and talking to patients' families about stuff. Those are all reimbursable coding, but you got to know how to do it. And I give you the template for it. I give you examples on how it's done, and I give you the parameters on which you do it. That's a $300 program. It's $299. If you're a student, you get it for half off. So let's go to what the offer is. Okay, there it is, 30% off. This is what the price is. It's normally a $999 offer. It's $699 when you go to pragmaintel.com/CHUSA. That's a special page just for you guys. Nobody else gets it. If you go to my regular website, it's $1,000 for the training. And I don't even offer, at this point, adding the staff for the training as well. So for $13.99, you can train 3 people in your staff as well. So that's the program right there. We'll come back to that. I'm going to actually leave that there while we go through and answer some questions. So let's look at those. All right. The question here is, what if health insurance is primary and I'm not in network? Well, first of all, there is no primary on PI. So if that's the thing, if you're dealing with the personal injury care, health insurance is not primary. Now, the attorney may want you to use it, and that's fine. Realize that when the health insurance company finds out that that there's a car crash, they're going to get their money back from that settlement. And there are some certain things that happen that they can't get their money back. If the policy limits are maxed out, then the hospital or not the hospital, but the health insurance doesn't get any reimbursement if the policy is maxed out. So, and there are some other specific kinds of things that they might be able to wiggle around it, but typically not. So health insurance is not primary. And if you're not in network, that's awesome because you don't have to deal with it. But if you are in network, what do? Well, you've got a problem. You have a problem because many insurance, Coventry Health is the one that comes to mind. They actually rent you guys out. If you're in their network, they rent you out to certain providers. I think State Farm is one of them. But they rent you out, and you have to accept whatever your in-network rates are. You can't bill your regular PI rates. But there's a way to get around that. There's some training for that on what you can do with your liens, and I'm going to be doing a lien webinar in about a month. Stay tuned to my website on when that is. We're going to talk about how you work with liens. Why do some cases pay along with care and some delay into the end? This depends. If you're in a PIP state, personal injury protection or policy, they'll pay up until the limits of whatever that state is. It used to be $10,000 in Florida, and then they're taking it down to $5,000, I think. Utah, it's $3,000. So that's the PIP. Then there's MedPay. MedPay has a certain amount too. So they will pay along as they go. But typically the third-party ones are the ones where the state doesn't mandate either one of those policies, and the patient hasn't elected to buy that as an option in their coverage. So they will end up having to pay at the end. Excuse me, which is kind of a pain because sometimes those cases take years. I had one case where it took freaking almost 5 years to close, and then I had to write the whole thing off. It was really irritating. But typically attorneys take a couple of years to close a case, and that's what I'm there to help them understand is you can close a case before care is done. And that's one thing that attorneys need more training on too, so I offer training to them. So we answered that. Let's go to the next one here. What about state-specific details? I'm not sure what you mean. Send me an email, and I'll tell you what I can find out about it. Pam, appreciate it. Templates for reports, I do have those. They're in my they're in the individual training modules. So that's going to tell you about different parts of it. Something that's going to tell you this is what your whole report looks like at the end, I don't do, typically because everybody's got their own version of their EHR. And so as a result, everybody's going to have some kind of issues with it. Just take the course material and figure out how to implement it in your EHR because there's so many different kinds. What about finding attorneys or training them to know what is important? I do that. So you just refer them to my office. That would be great. They can get a hold of me via the website. What do you do with CMS 1500 if you have more than 12? That's a totally awesome question. Thanks for that, Richard. Appreciate it. So with the 1500s, there's 12 diagnosis points for the ICD-10 you can do there. You have to do separate pages, addition to that, called supplementals. If you will shoot me out an email, I'll see if I can help you find some information on that. I do have some basic offerings for that that'll help you. My students get trained on exactly how to do that. Referencing research to support treatments. Not sure what you mean by that, but absolutely that's important to do. You got to make sure you have the right reports. Not all of them are going to be supportive. Some of them are actually detrimental to our case. You know, we find 1 or 2 points we really like, and we use those in our reports, and then we come to find out another part of that same report will work for the defense. So you have to be careful on that. What was the statement you made about rear-ended is not a cause of injury? That's a good question. Appreciate that, TJ. Here's the deal. A mechanism of injury is how the person got hurt. So if you have a bruise on a forearm, the rear end didn't cause that. The rear end delivered the force. What happened to the body inside? So you have to find out, did they hit their arm on the door, on the steering wheel, on the armrest, on their head, on somebody else? Find out, how did they actually get hurt? What do we know? And there's some great terminology you use in your descriptive language of the car crash. You got to make sure you put it in there as something that conveys severity of injury. And those are some great things we can get some training on. Does any part of the Colossus training apply to a required annual CE? Okay, the CEs part. You know, that's a great question. It depends. Some of the state associations that have you come and teach, they offer CEs. I haven't done CEs as a general rule, just because because there's only 37 states I can get a general coverage on, and I'm working with some chiropractic colleges to try to see if I can get it nationwide. It increases my cost, but if I can pass it on, we'll look at trying to do that. Here's another one. What about an insurance company saying we're investigating the case and then it takes forever? Well, you know, if there's an attorney involved, they can actually force them to give an answer sooner. They can't let it hang forever. So if you're working on a case that doesn't have an attorney, you definitely need to get one involved, because they're delaying you because they're trying to find some way to discount your care. They're trying to find some way to see that what you're doing isn't right. So you're going to want to make sure you get some help with that. You can demand that they give you an answer, but they're big dog in the pool, and they aren't going to really listen to much of what you have to say until you force them legally to do that. Here's another question. Can facet capsular ligament injury be diagnosed via digital motion imaging or other studies? The answer is maybe, but not definitively. And that's the problem we have. See, with the DMX, you can show that there's excessive movement, but there are certain things you have to add with that in order to validate that it actually was caused by the crash. Like, take my daughter, for example. One of my daughters is incredibly flexible. If you put her on a digital motion x-ray, oh my gosh, she must have torn capsular facets and disc injuries up and down her neck. That's perfectly normal. She's like super hyper flexible. She has a lot of extra movement in her vertebra. So you just can't go off of that. There has to be some symptomology that proves the point. The next thing you have to do is, even MRIs are not going to show you that you've got ligament laxity. First of all, very few of us actually do flexion extension imaging on MRIs, and then that's really poor anyway, because they can't, because of the apparatus itself, they can't get the full motion. So it has to be something that's done with a pain management that has to do with facet injections, and that's how we validate that. There's got to be a path to get it there. Here's another one. Can an attorney close a case before care is completed? Absolutely, yes, they can. But they have to know how to do it. So most of them just wait till the care is all done, because it's easier for them to check on the case once a month than to try to close it in the first few weeks. But it depends on your diagnosis. If you've got the right injuries diagnosed, then we know what the policy limits are, and that known injury that's been validated is going to exceed the policy limits at a minimum. He can close it today, be done. So there are certain things you can do to get them closed. Depends on the diagnosis. It also depends on the kind of injury that we're dealing with. If we got this disfigurement, that the case can close right away. Somebody got a pretty nasty scar on their face, it's probably going to close, and we don't need to wait till the end. Then the patient can pay you cash. You don't have to wait to get paid. It's awesome. So should I ask an attorney to sign the county lien before or after it's acknowledged by the county? The lien is yours. When you do a lien, and I'll talk about this in a month, so make sure you go to my website, look at my calendar regularly. I haven't got the link on there yet because I've got to get that established. But once the link is there, you can go and listen to that, because I'll talk about that in specific details. Should I ask, what about reviewing hospital x-rays? Is that payable? Yes, it is. It's a -26 modifier. But you got to know what you have to do in order to make that work. And I cover that in a more in-depth training, but you have to be able to go through and say why you even were looking at it. Did you find something they didn't see? And how does that apply to your particular care? So those two ways that you can get reimbursed on that. One is the -26 modifier, and another is on a counseling coordinator of care code. So you want to know how to do that. How long have you done this, and how are you trained? Good question. I've been trained by insurance executives and attorneys. So it's pretty cool. And I've been doing this now for since 2008, but full-time for the last 5 years. So thanks for asking that question. Do you have info about, and by the way, I've done thousands of cases. At one point, I backed off on a little bit because it was just crazy for me on time. But I was managing 1,000 active PI cases at one point with a team of 9 nurses and 2 doctors. So yeah, we've seen a lot. So here's the question: do you have info about best diagnosis when appropriate? That's what is that? Let me look at that for a second, guys. The question's a little. I think I'm gonna have to pass on that one because I can't understand what it's being asked for. I apologize, Pam. What did you say about support during the year of contract with you? Well, it's not unlimited support. It's a Q&A. You put your questions in. We give you an answer. It might be something we've already answered before. You might have a new one that we put into our question and answer pool. Yeah, I do give discounts to doctors that need to do consulting with me on a particular case, but I can't do the consulting for free. I think you would understand that. But I'm happy to help where I can. If it's a quick answer, I just pop it back in an email and send you on your way. If you're a student, then I can point you to the right module, go check it out in. So I try to do my best to support the students so they can be successful with it. Do you have info about best diagnosis and appropriate that creates best? Yeah, that one I'm still going to pass on. Okay. Looks like I might have gotten through the questions. Thanks a lot for staying. I know that most of you did, 2/3, which is great. I really appreciate that. I don't have anything more at this point. I do want you to know that on the slides here that the offer is there. It's a limited time offer. But if you go to pragmaintel.com/CHUSA, you can get yourself and all your doctors trained. I have a 14-day money-back guarantee. Get in, get started, see if you like it. If you don't, I'll refund your money. I don't have a problem with that. I just want doctors in this that are actually going to go out and get the job done the way we need it. So docs, staff, attorneys, few insurance people that filter their way in, thank you very much for your time today. I am very passionate about helping everyone get the best possible care they possibly can to get the settlement they justly deserve so that they can take care of the lifelong injuries that they have. Thanks a lot, and I appreciate your time today. Christy, back to you.
Thank you, Dr. Grant. And thank you, everyone, for all of the great questions today. I just want to remind you the webinar was recorded so that you can go back, watch the recording. You will get a link to the recording in about 15 to 20 minutes. If you have additional questions, I encourage you to email Dr. Grant, and he'll be happy to respond. Just want to remind you that next week we have Baron Hoig, who's going to be here talking to us about telling the chiropractic story the right way. It's a different take on coding and documentation. I don't know if any of you have seen Baron live and in person at State Association events across the country, but he does have a very unique personality and perspective in making some things a lot easier to understand, and he's really, really funny too. So I'm really excited about that presentation next week. The following week, we're going to be talking about how to build compliant cash plans when your patients have high deductibles. It's a growing concern across the country with more and more patients having deductibles in excess of $10,000, which means that essentially they're short of having a baby or having their appendix removed, they're not going to meet that deductible and be paying out of pocket for care in your office. So thank you again. We're going to end 2 minutes early, which I love. It means you all have an opportunity to inhale some food, go to the potty before you get back to treating your patients. So I hope you have an amazing rest of your day and a fabulous week, and we look forward to seeing you next week when we have Baron Hoig here. Thank you so much. Bye-bye, everyone.